I am very passionate about dentistry, and it is so complex, but it doesn't have to be. And the reason is because our population are not educated. We were born with healthy, beautiful teeth, and we can maintain our teeth until death. But we have to learn, and I believe we can, even when we have patients that come in with mouth that have missing teeth, malaligned teeth, periodontal disease, infections due to systemic disorders. If we could just take our time with that one patient and educate them, and then their health is improved, and they share that with their family members, that's a beginning, that's a start, that we can help our people not to have a debilitating mouth, which affects their total health. To rectify it, we can do that, but we also have to understand, how did we get here? Because once we restore, we want to make sure that we keep that restoration. We don't want our mouth to continue to break down. We want to be healthy. So how do we reconstruct the mouth? Well, first thing is getting to know the patient, having the same goal in mind, and willing to learn, each of us together, how we can have success at the end. And we, as a dentist, we already have a picture in mind of what we want you to look like. And we can give you options and let you choose which one you prefer. And then once we start that journey, we started by taking care of the worst problem first, the problem that would cause you to go to the emergency room, the problem that would cause you severe pain. That should be taken care of first. And then after we've taken care of the acute situation, then we start working on the chronic problems and in baby steps, just like we would do with our children. Children are apprehensive about dental care. So you do something very simple on a child the first time. And then the second time you see the child, you can do even more. And the third time, you probably could complete the child's total mouth in one visit. And we do the same for adults. But it's different because bad habits are hard to break. And we keep a mirror, a hand mirror for our patients, so they can see step by step and see the improvement, and they have confidence. And by the time we finish removing the most severe problem, and we have a good foundation with good oral hygiene, the gingiva is no longer inflamed and red, but healthy, then we start our restoration. We actually do this in our practice, and it works. That's the reason why I believe in it. And once you have that good foundation, then the patient has the options of implants, bridges, orthodontics, number of treatment plans to give them that beautiful smile that Almighty intended for them to have, and it's functional. We don't call that cosmetics, we call it aesthetics.